So Michelle and I are doing this program. It's really Michelle's program, but I'm going to add some human touches to all the necessary but not boring.
They're a little dry.
Yeah, all the dry facts. With over 20 years of experience in the Medicaid field, Michelle Dempsey assists seniors and disabled individuals with Medicaid applications to pay for long-term care costs in nursing homes and out in the community. She enjoys helping families get the services they need to pay for their loved ones' care. Prior to starting her own firm in 2011, she worked for 7.5 years for an elder law attorney as his Title 19 paralegal. She's also a longtime member of the Senior Resources up in Norwich. Hopefully you all know about that organization, which is another really, really helpful organization. She was on their board of directors and previously held positions of community relations chair and vice president of the board. She currently serves as their treasurer. Spending time with family is extremely important to Michelle. She is the biggest Disney fan I know of. She enjoys visiting the parks at Walt Disney World with her mom at least once or twice a year and loves escaping into a long fantasy series to relax. So that's what you have to do when you when you have to deal with government programs all day long. All right, so we're gonna start. Connecticut Home Care Program for Elders. Just a show of hands, how many people have heard of it? Okay, well, good. Then we have a fresh audience to talk to. So these are the types of services that we need covered when you're looking to care for someone, specifically in the community. So homemaker services, chore services, home delivered meals, companion services, adult day center services, emergency response services, adaptive technologies, minor home modifications, and personal care assistance. Those are all the type of things that are not covered by your Medicare, but are covered under these programs. The visiting nurse and the home health services tend to be covered under Medicare, but if your loved one is strictly on Medicaid, then they would be covered under Medicaid itself.
There are two main levels of the Connecticut Home Care Program for Elders. There's both a state-funded level that has more generous asset limits, and there's a Medicaid level. To qualify functionally, there's actually two qualifications. Qualifying functionally, meaning you medically need the program, and to qualify financially, meaning that you meet the qualification standards for assets and income for that particular program. To qualify functionally means that you need assistance medically with critical activities of daily living, and we'll go over what those are in the next slide. To qualify financially means you meet the income and asset requirements for either the state-funded or Medicaid level of the Connecticut Home Care Program for Elders. Activities of daily living include bathing, needing help to properly bathe yourself, eating or feeding, need to properly feed yourself. It's not meal preparation. It is actually having someone assist you with eating. Toileting, needing help to go to or from the toilet or properly clean yourself afterwards. Transferring, needing help to safely transfer in and out of chairs or beds. So going from a bed to a sitting position to a chair, or from a chair to a standing position, and needing assistance in those different activities. Behavioral, it's needing daily supervision to keep from harming yourself or others. And that might be that you need supervision to keep from forgetting to leave the stove on and walking away and forgetting that it's going. On the next slide, the functional requirements for both programs are listed. And you must, for both programs, be age 65 or older and be a Connecticut resident. Where they differ is in how many activities of daily living you need assistance with. So for the state-funded, it has a need level of 2 critical activities of daily living, whereas the Medicaid level is a little more stringent, and you need assistance with 3.
So for those of you who have loved ones who may resist care, they could be still living alone and feel that they are fully able to do that, and they don't want strangers in their home. Is that a scenario that you're familiar with? So we had a client who was of that ilk, and she believed if people came into her home that she had to wait on them, that they were her guests. So it was a major challenge to find a way to provide the care that she really did need without insulting her. So we had, she was fortunate to have long-term care insurance, so that was covering her when everything started. And she loved to tell stories, so she would tell stories to her guests. She was one of the women who broke the glass ceiling way before it was a thing. And her stories involved that type of independent streak from when she was a little girl. So because she would not let her caregivers help her, we had to find a role for them. So they became her scribes, and they wrote down her stories, and in between they might make her some lunch or clean some dishes, vacuum a little bit, but it became a very different relationship and one that worked really well. So once they wrote down her stories, we started to get it organized, and we were able to put out a book, A Woman Determined. And she had Alzheimer's coming on, and it did eventually take its toll. And I was able to get the book published after she passed away, but before her celebration of life. And the really heartwarming part is even the night before she passed away, she was identifying photos and telling me who those people in the pictures were so that they could be in the book and be identified accurately. So Alzheimer's is that funny thing. You never know when it clicks in and clicks out. And we were able to find ways to keep her safe, keep her home where she really, really wanted to be, but to keep her independent, at least in her own mind.
There are a couple of financial requirements, but there are often ways to work around those requirements. So I wanted to at least mention those. Income limits. You can get around those income limits using a pooled trust. A pooled trust is one where assets are pooled together to be invested, typically. They are now used to go around the income limit that is set by the federal government in order for people to qualify for assistance. So I don't want to go too much into the details of the pooled trust. We can do that in the question and answer segment if you are interested. Asset limits. There are ways to convert assets to income using a Medicaid exempt annuity, or to spend down the assets themselves on other assets that might be exempt. So we'll cover those in a few minutes.
Another client of ours needed to do that. She had, her income was a little too high and her assets were a little too high, so we had to find ways to still fit. She lived in an assisted living facility, so that doesn't rule out the ability to qualify or to need these programs because she was in an independent apartment. So we did a pool trust. It does require, there is a organization, a nonprofit within the state of Connecticut that does this, and you have to work with an attorney to do it. And we were able to, it's ironic the way it works. You send them money every month, and then they use that to pay some of your bills. So the whole goal of this program is that if you have money that you can access, if you're over these limits, you don't qualify for the program. So the way to work around it is to give your money to this organization that is approved by the state of Connecticut, and they then pay your legitimate bills. So her rent was she paid her rent, but she did it via this pool trust. And then she qualified for 37 hours of care while she was living within the assisted living community. And that gave her coverage in the morning, coverage in the afternoon or early evening, 5.5 days a week, and her family covered her the other day and a half. So it worked out really well, but initially, if just looking at it straight up with the assets and income requirements, she would not have qualified. But that's what we do, is try and make it work without cheating the government.
So what is excluded? Your primary residence, and the slide is not entirely accurate. I did not update it. The state no longer places a lien against a property. However, if you die and you own the property and it goes into your probate estate, the state may file a recovery action for any Medicaid benefits they paid out during your lifetime. So, yes, your house is excluded under the Connecticut Home Care Program for elders, but there are some repayment options that the state has when you pass away. If you go into a nursing home and you own the house solely, and you don't have a spouse to be able to transfer the house to, the house would need to be sold. So I just want to make that clarification, that while you're living in the house or while your community healthy spouse is living in the house, it is entirely excluded. If you are in a nursing home, you can transfer the home to your spouse. And then it is, again, completely excluded from any recovery action when you pass away. One vehicle is considered an excluded asset. If you have a second vehicle, it does count as part of your assets. So you want to exclude the more valuable vehicle if you have two. Burial plots and prepaid funeral contracts within certain limits are excluded. And for irrevocable funeral contracts, you have the ability to exclude up to $10,000. For burial plots, it's kind of interesting in the state of Connecticut. They define a burial plot a little differently, and there is no maximum value assigned to these particular items. They include not only the burial plot, but the headstone, the outer burial container, the casket or urn, and the opening and closing of the site. So if you work with a funeral home, they are able to set those contracts up to make sure that you meet Title 19 Medicaid requirements or the requirements for the state-funded home care program, which are the same, so that you can qualify. You just need to let them know in advance that that's what they need to do.
And that's one of the better ways, if you have your assets are too high, to prepay for one of these funeral contracts is one of the best ways to spend down some of your assets.
Especially since, as I will get to, life insurances are kind of a unique asset. Your furniture and your personal belongings, the state does not count. So unless you have a Monet or something of extreme value that you are insuring, the state is not going to go after your personal belongings or your furniture.
What about your pets?
They don't go after your pets either.
Sorry.
The pets are excluded as well.
As valuable as they may be.
Yes.
They might go after your racehorse, however.
There you go.
Certain life insurance policies are excluded. So if they are a group policy or a term policy that has no cash value, they are excluded entirely. If the face value on a universal life or whole life policy is $1,500 or less, or the total of all such policies are $1,500 or less, they are exempt. If they total $1,501, the cash values on those particular policies will count towards your asset limits. So let's say you have a $750 policy and an $800 policy that you've had for 40 years. Right now, if you retained both of them, they total more than $1,500, and the cash values of both policies would count. If you surrender one policy, the remaining policy is exempt. So you could take the cash value from that surrendered life insurance and put it into a funeral contract, and then it would be exempt. And many of us have life insurance to cover burial expenses. We want to be sure that our loved ones can take care of those expenses and it's not a burden to them. So, as Anne Marie said, it's a great way to spend down assets that you cannot keep and be able to qualify for the program.
So as a continuation of the what's excluded is the primary residence. And since this is a caregiver series, I want to mention this very consequential exception. If your family member is living in their own house and you are their primary caregiver for 2 years or more, and you can document that, it has been known to happen that that house can be deeded by your elder parent, usually, to you. We had a client that had sold her house to move in with her mom and her dad, took care of both of them. Dad passed away, and then mom needed more care, and it took over 2 years before she could no longer stay at home, and we had her on the state-funded program that whole time, but then she had to go to a nursing home because her medical needs became too extreme to be able to be managed at home. So she went into the nursing home, and we were able to go for full-fledged Medicaid, and the house was able to be transferred to the daughter without penalty because she had been an incredibly conscientious, loving daughter and had been at every doctor visit, every hospital visit, so that she could document that she had, for at least 2 years, kept her mother out of needing a nursing home by providing the care. So it was a great relief for the mom who wanted to give this house to her daughter, knowing that her daughter had sold her house for that. So it worked out well. As much as we like to say that the Medicaid caseworkers don't really have hearts, every now and then they do.
There is one other case where that house can be transferred and other assets, and that's if you have an adult disabled child. And I did not include that in the slide, and I apologize. But if you have a child that is considered disabled by Social Security, it is the biggest loophole in Medicaid requirements and policies. You can transfer everything you own to that child without any penalty. And by penalty, it's not that the state comes and says, give us money. They say that the money has to be given back to the individual who gave it away that needs assistance and is applying for Medicaid, or they will not provide the assistance that you would otherwise qualify for a period of time, depending on the cost of long-term care services in the state of Connecticut.
Could you repeat that?
Yes.
Not all of it, but just.
If you give away assets, the state will say you are not qualified to get assistance that you would have otherwise received for a certain period of time, during which you have to have already applied for and been ready to be approved for Medicaid before that period starts. So for every $15,000 approximately that you give away at this time, based on the cost of long-term care in the state of Connecticut, is a 1-month delay in the start of services. So it's very important to know that you can't simply give your house to your children and expect to be able to receive Medicaid services immediately. If you give your house away or a pool of cash to your children within 5 years of applying for the Medicaid program, these penalties can be enacted. And if the state has uncovered them as part of the application and you did not disclose them, they will apply these penalties. And it's not that they say that you have to give them a certain amount of cash, it's that the cash either or gift needs to be returned, or we will not start services for a period of time.
If your loved one no longer needs their car and they want to give it to you, it has to be at fair market value, or that is a gift. So it's that gifting thing that they look at. Everything has a value, and the state, in that 5-year look back, watches for that.
I want to just make sure I understand this. What if you're the caregiver for your spouse? And does the house just go to you because you live there, done in both your names?
Any assets that are transferred between a married couple are exempt transfers. They are not penalized by any gift penalty. So the ill spouse can transfer the house to the healthy spouse. They can transfer all of their assets once liquidated to that individual, your spouse. You cannot then give it to your children. That's a gift. Transferring it between spouses is allowed, but transferring it to children, a family friend, your neighbor,
Siblings.
doesn't matter. That would be considered a gift and penalized accordingly. So
If it's done before 5 years, it's okay.
if it's done more than 5 years before you apply for Medicaid, then it would be okay. It's outside of what they call the look-back period. So what does it cost to get on this program? There may be an applied income that is charged for anyone currently with income over $2,510 in gross income. This number will be adjusted in March 1st of 2025 to $2,608. On the state-funded level only, there is an additional 3% copay for any services received. So
we're going to talk about the distinction in what services you can receive on the state-funded versus the Medicaid, to help you
yeah.
sort of grasp this.
In terms of qualifying, there is what is called a spousal assessment for married couples only. Are there individuals in the audience, let me just ask this question, who are married and considering applying for Medicaid for their spouse? Okay,
Yeah.
so I'll cover it. I didn't want to cover it necessarily if there was no one in the audience that it applied to. A spousal assessment may enable the healthy spouse to keep a minimum of more than the minimum of $50,000 on the Medicaid level of the program only. That spousal assessment date is set based on a hospitalization or nursing home stay of 30 days or more that they are consecutively out of the house. So if that occurs, the spousal assessment has been set. Even if you never apply for Medicaid for the next 3 years, you have set that spousal assessment date based on that hospitalization nursing home stay. So one of the things that's important to know is it does not have to be related to your diagnosis. It could be that you fell and broke your hip and later developed Alzheimer's, and you need assistance because of the Alzheimer's, but you stayed in the rehab facility and nursing home for more than 30 days 2 years ago because of your broken hip. Your spousal assessment date was still set with that broken hip. It doesn't matter that the disease that you now need assistance for is something entirely different. So I want to make that clarification. Typically, without a 30-day stay in a nursing home or hospital, which is rare if you have Alzheimer's, the Medicaid spousal assessment date is the date of the Medicaid application received by the Department of Social Services. You can, with medical records, occasionally get that date set backward in time to a diagnosis date of something like Alzheimer's, if you can show that you needed assistance that was at a level of needing a nursing home had you not had a spouse there to care for you. The healthy spouse can keep 50% of the assets on the Medicaid spousal assessment date, from a minimum of $50,000 up to a maximum of $157,920, plus the excluded assets that I previously mentioned. These figures are adjusted on the January 1st of each year. I have seen them go up. I have seen them stay the same. I have never seen them go down.
So I think if it's important to understand there's a distinction between assets and income for a married couple. Assets are joint, so it doesn't matter if it is one spouse's IRA, pension, stocks, it is considered a joint asset. Incomes are considered to be your own. And that's where that spousal assessment is so important, because it determines how you spend down your money as to whose half it comes out of, in a way. But it's an odd distinction that a lot of couples don't understand. Well, that's my IRA, but it isn't, it's our IRA. So you have to always keep that in mind.
Yeah. It doesn't matter whose asset the name is in. It is considered the married couple's assets. So until the Medicaid application has been submitted and approved, everything is considered kind of joint at that point. Once the application is approved, most of the assets should be transferred to the healthy spouse's name. You want to then reduce the assets left in the ill spouse's name to less than $1,600 to meet Medicaid requirements. And that's something that they do a redetermination once a year at least, if not twice a year, to ensure that people are still qualifying for the program and that married couples have taken these steps. For the Medicaid level only, a healthy spouse whose assets currently exceed $100,000, they may request a spousal assessment if his or her spouse does not already have a spousal assessment date. If they have less than $100,000, the healthy spouse will be only allowed to keep the minimum of $50,000. And that's again because of that 50% rule. If you have $75,000 in assets together, you would be able to keep $50,000. If you have $200,000 in assets, you're able to keep $100,000. If you have $400,000 in assets, you're able to keep the maximum of $157,920. So that's kind of how it works.
And then the unhealthy spouse, the spouse that is in need of services, has to spend down their half to $1,600 before they can qualify for services.
It can be spent on either one of the couple. So that spend down, as long as it's benefiting one of the married couple, is allowed to be spent. So this could mean new furniture in the house, redoing the kitchen. It could be putting a new roof on the house, which is an exempt asset. So when you increase the value of the house, you're increasing the excluded asset. It could be adding safety bars and a ramp to the house to make it safer for the family. Spending down that excess money on a prepaid funeral contract or a new car.
New glasses, new dental work,
Yep.
clothes.
Anything that benefits the married couple, either individually or jointly.
Or a vacation. You can take a vacation. It benefits you. Questions are to be held, if possible, okay?
The spousal assessment that you can request may cost $50 if you do not immediately follow up with a Medicaid application. Okay, so why would I want to do this? Why would I want to go through the process of a spousal assessment? You want to capture your assets at their highest point to be able to keep the most money when you go to apply. And so applying for a spousal assessment date, even a year in advance of when you actually need the services, can benefit you because in many cases, you are spending those assets over that year-long period on care, on different expenses that may be coming up to modify the house to make it safer for your loved one. So in that case, you would want to apply for the spousal assessment date. If at least 2 years of medical records and doctor's letters and documentation showing that the ill spouse needed assistance with at least those 3 activities of daily living as of a prior date and time, DSS, the Department of Social Services, might allow the spousal assessment date to be set to a prior date in time, prior to your application date, is what I mean. So if you don't request a spousal assessment and provide all this information, and your loved one was diagnosed with Alzheimer's 2 years ago and needed a significant amount of assistance over the last 2 years, and you helped keep them out of a nursing home, you may be able to take those medical records, submit them to DSS, and say, okay, I think my husband qualified 2 years ago medically for this program. Can we set the spousal assessment date back in time to that date? And I think that's important to know. It is a difficult process to go through because you require a lot of medical records, a doctor's letter, and a caseworker that is willing to work with you. But it can be worth it, especially if you have been spending assets on care services over that 2-year period and never even knew that the Medicaid program existed. So you didn't know to apply for a spousal assessment date. You didn't know to apply for assistance during that time. So I wanted to make that distinction clear that there is an exception to the rule. It's just a difficult one to document.
Another thing to remember in case you might need to apply for this is the 5-year look back in bank records, all financial statements. Sometimes banks charge you per page. So it's a good idea to always try and keep your bank records for a 5-year look back of your bank records, your stock portfolio, anything like that, so that you don't get caught having to pay per page for their research to get you those records.
Yes. For a Medicaid application, in many cases you can get those bank records for free. For a state-funded application, the state won't issue a letter formally requesting that information because it's not a Medicaid application. And so the banks aren't required to waive the charges for all that research and duplicate statements. I often recommend that my clients look at either their child or their spouse helping them set up online access to their accounts, if only to download the bank statements each month and put them on their hard drive. If you don't have room for all the paperwork that accumulates from your bank accounts, 1, consider consolidating, but 2, look at downloading those statements to a flash drive or to your hard drive and saving them so that they can be printed at a later date if needed.
Because most banks don't let you go back further than about 2 years, sometimes only 18 months, on your electronic access. And the other thing is that if you've changed banks, opened accounts, closed accounts, all of those have to be hard copy documents. So you may think, oh, I closed that account, it doesn't matter, it was 3 years ago. It does matter. So it's a tedious chore, but
It's actually the hardest with closed accounts to go back and find those records.
Before the 5 years or during the?
Within the 5 years. So just
Within the 5
if as you're going along, you close a bank account, plan ahead and keep the documents. And sometimes,
Within the 5 years?
yeah,
Okay.
yep. And there are some DSS caseworkers who want a letter from the bank saying that the account is closed, not just that the balance is 0. They want a letter saying it's closed because some people will have an inactive account, so there's a 0 balance, and then they put money in it. So it sometimes depends on the caseworker that receives the application, what they
Yes.
want.
And if you transfer all the money out of an account, and it has a zero balance, and you never formally close the account with the bank, you will continue to receive statements for a period of time showing that you have a zero balance until the bank finally says it's a dormant account and closes it. If you are applying for Medicaid, you will need all of those zero balance statements up to the closure date in order to be able to qualify for Medicaid. It's a crazy system, but they want every account statement up to the date of closure, not the zero balance date. They want it up to the date of the account closing formally at the bank. So if you transferred money out of the account in September and didn't close the account until January of the following year, you need all of those interim zero balance statements between September and January when you closed it, and verification from the bank that the account is closed.
And for stock brokerage, it's even harder than the banks. You may have taken all the money, but there was an interest that didn't show on the last statement, so you didn't take that out, and you could have a 1 penny balance for years. So it's one of those things to try and think ahead on and be prepared and have the backups available.
And formally close the account
Yes.
with your financial institution and have paperwork showing that it's closed. So put that with your records, save it, scan it and save it on your hard drive, keep it. It's important.
And the reason behind all of this is because they're trying to avoid providing services that we are all paying for people who really could afford it but kind of hid their money or gave it away. So that's why we all have to do this now, because of people who tried to game the system.
Yep. I had heard of a case prior to my getting involved in the field where one statement was missing from an application. It was the same balance going in, the same balance going out, but 1 month was missing. And that month was actually very specifically missing. It was because someone had transferred money out of an account that they hadn't disclosed into it, and then transferred it penny for penny out of it the next day to another location, a different bank, a different person, who knows. But that statement was very specifically excluded, and the state later found out about it.
I mean, the state wants to know if you're expecting to receive an inheritance or a lawsuit finding. So they are looking for any source of money that you might be getting down the road. And you have to sign these applications saying they're true, they're honest. So for those kinds of things, it is your best bet. But for the other ones, it's not true if you said it, if it was a lie. You have to be honest.
What are the financial benefits to the program? For the state funded, for the Medicaid level? For the state funded, you receive about $2,900 per month in assistance. This does not go to the individual that is receiving the assistance. It goes to the providers of the care. So it's paid by the state to those providers that are signed up under the program. And under the Medicaid level, you can receive up to $5,900 per month in assistance.
And just to let you know what that means, so that $2,900 a month for the state-funded level can get you 37 hours of care a week. And they break it down, so when these applications, when you apply, there is an organization called CCCI, Connecticut Community Care Incorporated, who contracts with the state of Connecticut. They send a case manager out to do an assessment to see what ADLs you truly need assistance with. They determine how much care they believe you need, and if it is within those 37 hours, then they contact a care organization that is also contracted with the state. So it's not like you can have a friend come and be a companion homemaker and get paid by the state. It's only agencies that are licensed with the state and agree to, in essence, pay their workers at a slightly lower rate than the private pay organizations do. And that's how it works. And then on the Medicaid level, you can have a live-in. You can have up to 24-hour care in your home paid for by the, paid for by the state. So that's the big distinction in need. If you only need day, hourly kind of work, state-funded program usually is sufficient. If you need a 24/7 caregiver, you have to go full-fledged Medicaid.
Sorry, maybe it's a stupid question, but can you have both? How does it work? It's one, either one?
It's one or the other. If you are financially qualified for the Medicaid program, they will force you to apply for the Medicaid program, even if you only wanted the state funded. So it's based on your financial assets and income as to which program you qualify for. And they are always going to put you on the Medicaid program if they can. And the reason for that is the state-funded program is paid solely by the state. The Medicaid program, the costs are shared between the federal government and the state.
Or at least they were.
For now, they are.
Right.
So who decides where you go?
That would be dependent on your assets.
Yeah, but that is who? What organization decides?
The Department of Social Services will review all the bank records
Which
to
is that
determine which program you qualify for.
Which is that Connecticut?
Yes, Connecticut determines it.
Okay.
And anything that involves the federal government, the state still has some say in it, but you will find other states. In Connecticut, you can only have $1,600 assets as the person who needs the services. In Rhode Island, you're allowed $2,000, right? So
I believe so.
it's different from state to state, but it's in that ballpark.
And one of the handouts that I provided on the Connecticut Home Care Program for Elders not only lists the activities of daily living that you would need assistance with, it lists the individual financial requirements for assets for the program. So I believe for someone who is single, for the state-funded program, it is approximately $47,000 that you are allowed in assets, in addition to the excluded assets. For Medicaid, someone who is single, the asset limit is $1,600. So in some cases, if you have more than $1,600 at the end of each month, even if it was given to you, someone gave you assets, you technically don't qualify for the Medicaid program and could apply for the state-funded program, which is an easier process. So,
And sometimes it's you receive money that you had no control over. We have a client who she's not 65, but she is disabled, and her dad passed away. She inherited his Social Security, and it has kicked her out of all of her programs because she was on Medicaid due to her disability. So it's just sometimes it's out of your control that you
and
got
it's
money.
complex. You could have inherited his IRA, and all of a sudden now you have assets that put you over $47,000. Now you aren't qualified for the state-funded program either. We
And
discussed the Medicaid asset limits for couples, but there is also a Medicaid, an asset limit for couples that is different for the state-funded level that allows you to keep more than the minimum. I believe if you look on the handout for the Connecticut Home Care Program for Elders that I provided, it's about $61,000.
Somewhere there, yeah.
So you can have, let's say that you have $100,000 and you only would be able to keep $50,000 and $1,600 if you qualified for Medicaid. You could spend down to $61,000 and qualify for the state-funded program and be receiving assistance under that program while you're applying for the Medicaid program. So it's an easier process to get on the state-funded program because it's not as rigorous a look back at your financials as it is for Medicaid. Medicaid is rough. They examine every single document that you can imagine might be needed. And I'll go into what is needed in a little bit. There's also verification lists that discuss what is needed for a Medicaid application for either a married couple or a single individual. You don't necessarily need both verification lists. Only one is necessary for your particular situation. So what are the application differences? There's a 2-year financial look back for state funded. And in some cases, they don't even go into the full 2 years. Especially if they notice that your assets are fairly stable and haven't changed significantly during that period. On the Medicaid level, they go into a 5-year look back, and it is a much more rigorous review of all those records. For home care applications, they look at every transaction that is $1,000 or more, every deposit, every withdrawal that is $1,000 or more, and they are allowed to question any transaction that they choose to. So if there is a pattern that is disturbing to them, let's say you have checks for $999 coming out every single month, they can question those transactions as well. So they dive into those financial records.
And they have a whole box of red flags.
So what do I need? At the minimum, for a Medicaid application, you need 2 years of every statement. So if they're monthly statements, if they're quarterly statements, you need every statement for 2 years for any financial account that was open during that time period. And the end of year statements for the outlying 3 to 5 years. So if you were currently applying, those 3 to 5 years that you need end of year statements for would be December of 2020, December of 2021, and December of 2022. And as I mentioned, you would need to verify all transactions $1,000 or more that are not clearly identified as being, let's say, Social Security or your pension coming in every single month. Those routine transactions, they understand, they're clearly identified on the bank statements, they won't question them. If you get a check and deposited every month for your pension, they will question those.
And
Financial accounts also means credit cards and mortgages account?
No, they do not look at your credit card statements currently. However, they may ask for mortgage records if you have taken out money on a home equity line of credit or a reverse mortgage where you have a line of credit. They are also going to ask for any settlement statements for any real estate transactions, refinances and purchases and sales during that 5-year period. So if you have refinanced your house, if you have gotten a reverse mortgage, within 5 years of applying, they're going to ask for what is called the settlement statement, which lists the buyer and seller expenses and payments individually.
You have all this on a printout.
There is a printout that lists all of the verifications for both married couples and single individuals. No?
yeah. And another thing to keep in the back of your mind is the state always wants to know your gross income, not your net. So if you think, oh, my bank statements show my Social Security and my pension and all that, they want to see the gross one. And they qualify you based on your gross income, not your net. So if you have a pension and they don't send you a statement every year, hold on to the one you do have, because they're going to want to see what that pension is, the gross one, because you're going to have medical benefits taken out of it. So that's why what's comes into your bank account is your net after you pay your premiums are taken out. So it's always think gross.
In addition to the financial records, they look for identification documents and health insurance cards. So this might be your Medicare card, your Social Security card, or verification of your Social Security number. They ask for copies of all of your health insurance cards. So this might be your Medicare card, your Medicare supplement card, your prescription card. If you have a Medicare Advantage plan, they're going to want copies of those Medicare Advantage plan health insurance cards. They're going to need verification of other assets, such as your funeral contracts and burial plots and savings bonds. Copies of life insurance policies, and if they have a cash value, what that current cash value is. Copies of the registration for any vehicles owned, and deeds to any real estate owned or lease if you're renting. Also, they'll ask for the bill of sale for any car that you might have sold within 5 years, or campers or boats, etc. Verification of certain expenses are needed, such as real estate taxes and homeowners insurance.
And the other thing with your premiums for your insurance, they may want to know how much you pay each month for each type of premium for any of the health insurances. And then also every December from Social Security, you get your annual certification letter, your annual benefit letter. Hold on to that, because that shows the gross and the net things that come out of it. So that's a really important document. It's more important than your 1099s, which they also sometimes will take if you can't find other things.
About
Sounds like you're gonna have boxes and boxes of paperwork.
Well, you just keep the newest. Of those, you just keep the newest. You don't have to have 5 years of your benefit statement from Social Security, but always keep the newest.
I often recommend, when people come in to see me, that you start a file box that is devoted to just what is needed for a Title 19 application and set it aside that way. It doesn't have to be super organized. It doesn't have to be by account and chronologically in order. It's having the documents that's really important, and having them in a central location where they can be found. And so the biggest tip I can give is keep good financial records. That will help prepare you and your family for any eventual Medicaid application that might need to be done. If you are a child and you have no idea what your parents' accounts are, have them at least tell you what financial institutions they are working with. Wells Fargo, Chase, Charter Oak, Navy Federal. Where are their accounts actually located? So that if for some reason they have a heart attack and can't talk and tell you where their banks are, or they can't remember because they've gotten Alzheimer's, that they had an account 3 years ago at Charter Oak for a CD that had a great deal. Have them at least tell you what financial institutions they have dealt with in the past 5 years, so that you have somewhere to go.
Fortunately,
don't
we're
have
past
the
when
records.
banks used to give out gifts and people would go and open an account in every bank. That's mostly past the 5 years now.
So how do I apply? There's 3 different ways of starting the referral process to the Connecticut Home Care Program for Elders. Referrals can be accepted online. You can download an application, and I also brought a copy of that application for you. So it's one of the handouts that is on the table. It is labeled at the top, in the top left-hand corner, W1487. For more information, you can also call a number up in Hartford that is 1-800-445-5394 and select option 4. The application form, the W1487, has an address that it can be mailed to or faxed to once it's completed. If you need this presentation sent to you, I have a list. We can have people put down their email address and I'll send you a PDF copy of the entire presentation if you need it.
So this
But I
is-
did bring the actual form, the W-1487, that is used to make a referral. So you can either do it online, or you can fill out this form, or you can call the number that I gave you, and they will send you this form. So,
So this is who we are. Then we thank you for coming.
Thank you.